Two wants to know what you want to know. We're joined by our experts to talk about all things Medicare and health insurance today. We're giving you the information that you need to know, and our experts are taking your questions live. So you can start texting in your questions now. Send them to the number that's on your screen, 336-379-5775. You can get those questions answered in real time. All right, Catherine Sevier with AARP and Steve Edmonds with Alliance Insurance Services are here. All right, first and foremost, we are going to talk about health care and we're going to talk about Medicare. So, Catherine, let's first start off with Medicare and when you have to sign up for Medicare. Let's go over the timeline.
Sure. So Medicare is the insurance for us as we age, and as you approach your 65th birthday, 3 months before to 3 months after, so there's a 7-month window that you are expected to sign up for Medicare. You sign up even if you're still working, and you can make some selections that allow you to waive part of Part B if you're still working and have credible insurance. But you must sign up during that 7-month period, or you will be subject to penalties later.
All right, and so we want to keep that graphic that you just saw there. At the very bottom, it said you're going to get a penalty if you don't sign up at 65. So I know that there's a lot of you who are going to be asking extra questions about that. That's fine. Bring them on in. Text us those questions. But that is it. It's the 3 months before your birthday, the 3 months after your birthday. That is when you need to sign up. Otherwise, you will pay a penalty. All right, let's talk health insurance, just overall, broadscape health insurance. There's something, Steve, called the family glitch. What is the family glitch?
Sure. The family glitch is a really well-kept secret. It's a brand new thing for 2023. And basically, what happens is the federal government sets guidelines of what they consider healthcare affordability. That just simply means the premiums that a person is paying to have health insurance. So what we're finding more and more is even if you are employed and you have coverage through an employer, if you have that coverage and then you add up your premium, your spouse's premium, and your children's premiums, if they're covered on the policy, and you add all three of those together, if that number exceeds 9.5% of your annual earned income, you have what's called a family glitch, which means the health insurance is unaffordable, and you then qualify for the Affordable Care Act and can apply for coverage through the ACA plans, which a lot of times is a lot cheaper.
All right, that sounded complicated to me.
So basically, to simplify it, if you are paying more than 9.5% of your annual earned income for health insurance premiums, you need to investigate getting covered under the healthcare.gov Affordable Care Act type plans. And a lot of times that will save you money on your health insurance.
Okay, so you need to take a look and see what your paychecks are, right, for the year, and then how much you paid out in premiums for the year, and see if it equals up to more than 9%. And if so, then you need to be talking to somebody about cheaper health care.
Absolutely. And to put this into perspective, and I'm thinking people are not aware of this, or they're not getting it because we're not getting a lot of activity on this in mid-year, and this is a great thing to investigate. But let's say you're making $50,000 a year, and then you're paying premiums through your employer for yourself, your spouse, and your children. If that premium is exceeding $400 a month, you qualify for the Affordable Care Act, because that would be more than 9.5% of your annual earned income.
Okay, and so what you would do then is you would possibly opt out of your own work insurance, and then you would go to the Affordable Care Act and look for health insurance that way.
Right, and you need to investigate that. And most of the time, you're going to have to talk with somebody that works in the, like an agent like me or somebody in that field to help you navigate through that. And here, the beauty of that is for 2023, the federal government is being very lenient with an enrollment period for this family glitch thing. Basically, they're saying from the time that you find out that your health care is unaffordable, you have 60 days to sign up for the Affordable Care Act. So it's an open enrollment period for the whole year of 2023, basically, when you find this out.
And when you say find it out, when you like get it, like, oh, by the way, I calculated it and it's coming up. Okay. All right. All right.
I mean, basically, yes.
Okay. All right, Catherine, we've got a couple of questions. This one always makes me kind of go, yeah, I know. I get what you're saying. They're saying, who made up this 10% forever penalty if you miss the coverage? And why is there a penalty to begin with?
So that's a very good question. The penalty has been there for as long as I can remember. It is a penalty that's baked into the administrative regulations of Medicare. And unfortunately, because it is 10% each year, it lasts for the rest of your life. So it really does make it critically important that you sign up on time and make sure that all the I's are dotted and the T's are crossed, that you've done it correctly so that you don't end up with a penalty later.
Yeah, I mean, it's like anything else, right? There's rules for everything that you apply to and have and whatever else. And so that is the rule, and it's better for you to know it than for you to not know it. All right, we're going to continue taking your questions coming up in the next segment. Again, 336-379-5775.